understanding, it wasn't so much the interest. A lot of hospitals, it was lines of credit. They had big lines of credit, and when there was a credit crunch that hit, they lost their lines of credit, which is what they were using to pay for the services. So that environment has improved. And so, again, we'll probably not get to the glory days where they just can spend, without thinking very carefully about it, but we are going to see some increases. Why? The next thing I wanted to point out was what they told us about healthcare reform. We've heard a lot about it, but what we all want to know is how will that affect us? Okay, a positive, the census will increase in the hospitals. Absolutely, the census will increase. More people will have access to care. There's no question about that. So it stands to reason they will need contract labor to help fill the positions. The nursing shortage is still in place. It is going to continue on a pretty traumatic path right up until 2018. So it's not that suddenly there's going to be more nurses in the workforce. So again, that bodes well for contract labor, travelers, and that kind of thing. The flip side is, the other thing that comes with healthcare reform, hospitals have to be more efficient. There will be severe Medicare payment cost cuts, okay? They're going to bundle. Instead of, hey, you can bill for every service, it's like, no, you get one fee for a hip replacement. If you have to see that patient 20 times, if you have to do it over, you get that same fee, right? So it's going to be a little bit of a different world for the hospitals. So that brings some uncertainty, I guess, on how it'll all play out. But what staffing industry analysts told us, uncertainty is also good for our industry because that's when people want to use contingent labor. They don't want to make big commitments to full-time permanent staff that they would then have to lay off. So again, they project the next few years and helping our hospitals get through this. We will all play a very important role. Another thing that is rolling out are the EMR implementations. That's one component, right, of healthcare reform. Hospitals have a deadline by 2000 and I believe it's 15 at this point, extended a year to get electronic medical records in place. It is a massive, massive undertaking. You guys have been exposed to it. The software companies like Epic are like, here you go, see you. And, there's meaningful use. The hospitals have to implement it. It has to be working. People have to be trained on it. So we are seeing opportunities for EMR staffing where they'll use travelers for a contract or more, sometimes up to 9 months, while they're training their own staff. There's also a need for nurses who have experience with those systems. And I know one of you said you kept a notebook on all the systems, because you're right. Epic could be used and customized differently in one hospital to another. If you have skills or experience with any of these electronic medical records, definitely point that out to your recruiter and make sure that they're highlighting that on the front of your profile, because hospitals are looking for that. They're always asking us, do you have, Epic trained nurses, or, McKesson's another one. So there's definitely some opportunities there. Other trends that will come with healthcare reform, because hospitals have to be efficient, there will be more care delivered in outpatient settings. Okay, so they're buying and setting up these clinics so that if they get one fee for that service, it may not all be happening in the hospital. So there will be travel assignments in alternative settings. We're even seeing them in retail settings like CVS, Take Care clinics, Walgreens. The world is changing, and so that could be a good or bad thing. There might be some nice, more low-key assignments available in these lower acuity settings that you might want to take advantage of. So that trend will continue. However, because that trend's continuing, they said that the patients who remain in the hospital will be sicker. They will be absolutely the most critical, sick patients, right? Because everybody else, if you're not, you're going to be in the outpatient setting. Meaning, the biggest demand is going to be for specialties. Okay, so probably less for general med surg. Just keep that in mind. More for critical care, ER, operating room, and certainly a host of other, maybe a little bit more for PICU and NICU versus general peds, that kind of thing. So those are just some of the trends that they're projecting.